Well, today we have Dr. Yash Agarwal. He's practicing in Muzaffarnagar. Well, we're going to be talking about kidney stone management as of now, and we'll be asking some very simple but very important questions to doctor. Very welcome.
Thank you.
Why do you think the number of cases of kidney stones are on high rise these days? What could be the reason?
I think the diet,
Yeah.
firstly. Secondly, the lifestyle. Hard water in our area. And of course, changing climate. The more hot it becomes, more sweating, the more concentrated the urine. And of course, precipitation of stones in the kidney. That happens.
Well, if you can recall one of the cases, most challenging cases where the patient came very late, and how did you tackle that?
There are enough of them. Patients usually come very late.
Yeah.
Especially in our areas, because of dearth of money, and no family in our area, they do not have any allocation of funds for their health. So what happens is they want to keep postponing, and that's why they come late. So there are a lot of patients who come with bilateral renal stones obstructing both the systems, or bilateral ureteric stones. Both the systems are obstructed. Apart from that, then they land up into uremia, acute renal failure, anuria at times. And so these are the patients who are very challenging. The creatinine goes up to say about 15 to 20, urea is high. So we got to stent them, pre-stent them first, or put in a PCN. And then in the second stage, we go ahead with stone removal, either RIRS or mini perk, one side at a time or both sides together.
Okay. Well, in your experience, what precautions can be effectively taken in order to avoid stones, and if they have had one, in order to avoid the recurrent stones?
See, in my experience, majority of the time, whatever may you do, recurrence does happen. There are a few subset of people where we can avoid recurrence of stones. Firstly, an important workup that should be done is a metabolic workup. But 5 to 10% of patients, they have inherent error in their metabolism. That is what leads to urolithiasis. Apart from that, we must have a stone analysis. What kind of stone is that? And accordingly, we can alter the diet and change the natural history of that particular disease. We can prevent stones in these subset of patients. Another very important one is uric acid stones. Majority of the uric acid stones, a lot of them have hyperemia, hyperuricemia, and these are the patients where when you restrict the non-vegetarian diet, so you can alter their natural course of that particular disease.
Well, there are a lot of misconceptions about kidney stones as well, if you would like to break any.
First misconception is that you take homeopathy and all stones will be tackled. Yeah. Second is that stones dissolve. Stones don't dissolve. A small stone, it can pass out through your system, but it will never dissolve. So these are the two main myths. And third is that surgery should not be done, because that will harm the body more than anything else. I mean, these are the three myths that patients, they usually come to us with.
Wonderful. One very last questions and very important question.
Yeah.
What are the first indicative symptoms a person can have an idea that I might be having a kidney stone?
See, majority of the time these stones, they tell the patient about their existence. They have very, very good symptomatology. The first one is pain most of the time. Second one is any dysuria or burning in urination, blood in urine, vomiting along with pain, and apart from that, a lot of other symptoms like fever. So usually, this symptomatology is there, and we get to know, or the patient get to know that something is wrong. They come to us, we diagnose it, and we treat it accordingly. But at times, a lot of patients are asymptomatic.
Are there any circumstances?
Yeah, there's lots of them. They are asymptomatic. They don't have pain. They don't have any problem.
How do they get to know then?
They are diagnosed basically because of some other disease. An ultrasound is done. You get to know it's a massive stone with massive hydronephrosis. Never had any symptoms. So this is the unfortunate part for those patients that they have never had any symptoms. Because whenever there is a symptom, we get to know something is wrong and some remedy can be done.
Yeah.
Suppose it's asymptomatic, so that harms the body more.
Yes,
Yeah.
yes. Well, that was amazing having a word with you.
Thank you so much.
Thank you so much for being here.
Thank you. Thank you so much. Bye.